Also joining us today are not only Dr. Ezike, but Dr. Wayne Duffus, who's our acting state epidemiologist, who first joined one of our daily updates earlier this month to talk about our contact tracing initiative. I want to start today by giving you a simple way to think about what contact tracing really is. When someone tests positive for COVID-19, a contact tracer will interview them to learn about their recent contacts with family, friends, coworkers, commuters, classmates, and others. And if their exposure to any of those people in the last 48 hours was significant, those individuals would be notified and told only that they had been exposed to someone who has the virus. No names given. Contacts are then provided with education, information, and support to understand their risk and what they should do to separate themselves from those who are not exposed, and how to monitor themselves for illness and the possibility that they could spread the infection to others even if they themselves don't feel ill. Contacts are encouraged to stay home and to maintain social distance from others until 14 days after their last exposure in case they also become ill. Another option for them is simply to get tested. This straightforward process truly does reduce the number of new infections. And if done at scale, it can be a very effective weapon against COVID-19. With Illinois' daily availability of testing among the best in the nation now, we want to grow our voluntary contact tracing so that we can further control and reduce the rate of spread of COVID-19 and stop outbreaks in their tracks. Not only that, it's arguably our most sustainable tool. Knowing if you've been exposed to someone with COVID-19 gives everyday Illinoisans the ability to keep their families and coworkers and friends safe by helping them seek testing or self-isolate. And it helps us to build a better public health system that truly supports them if their exposure leads to actual infection. Contact tracing is a long-standing disease control measure, not new, and one that's been part of our COVID-19 response since our very beginning of addressing COVID-19. But as cases reached a massive scale of spread in Illinois and nationally, our existing public health management infrastructure simply could not keep pace with the tens of thousands of contacts resulting from the thousands of positive cases that we've discovered each week because of our growing testing capability. In the first month of our COVID response, existing contact tracers in Illinois were able to handle the caseload. But the chronic underfunding of local public health departments, together with the fast movement of this current deadly virus, put a severe burden on those local public health resources, limiting their ability to engage in tracing all of the possible cases. Now that testing has ramped up, only about 29% of our known cases are engaged in a tracing process. That's a number we want to push as high as possible to the industry standard of over 60%. But given the sheer scale of our population's widespread susceptibility to COVID-19, we can't get there with our existing infrastructure alone. So what we're building in Illinois is a tech-based approach that innovates and scales up existing systems. Illinois has 97 county and city health departments, and they are the foundational elements of the new Illinois Contact Tracing Collaborative, ensuring that this is a locally driven effort. We're scaling up within our local health departments and providing a statewide technology infrastructure to ensure a coordinated operation. That way, larger health departments can assist where smaller ones need help, and the state DPH can help coordinate multi-department collaborations. Technology is really an important part of our Illinois Contact Tracing Collaborative. In fact, it's perhaps the most important part. Fundamentally, there are three component parts of the technology that we're using. First, a disease reporting software that can take in reports from across the state and aggregate information from many sources. Second, a common management platform that operates as a unified way for public health officials in all parts of the state to investigate and trace contacts. And third, an app for use by the COVID positive patients and their contacts, allowing them to get services they need and giving local public health departments an easy way to connect to patients and their contacts with the latest information and healthcare guidance. Let's talk about the first piece of that, disease reporting software. Illinois already uses a disease reporting technology called the Illinois National Electronic Disease Surveillance System. But because of the scale of this COVID operation, we are putting in place a state-of-the-art project management and comprehension tool to collect and hold all raw information relating to contact tracing for COVID-19. Of course, our disease reporting system and contact management software has to be seamlessly connected. So for the second piece of our tech solution, we're building a forward-facing relationship management software for deployment throughout the state. This will allow all local health departments to work on one platform and allow IDPH to operate with an aggregated real-time dashboard showing where and how pervasive COVID-19 is in every part of Illinois. And the third piece of our tech solution is the app. Every COVID positive patient and their contacts will be encouraged to download an app that gives them easy access to the public resources to assist them while they're in isolation. The greatest strength of this new integrated infrastructure that we're assembling is that it will allow us to reach more people and to do so at a faster pace. At a high level, this model of contact tracing operates with the same scripts and the same steps all across the state and still allows customized methodologies to account for the unique aspects of different neighborhoods and communities. With that community-specific element in mind, IDPH is working with Partners in Health, the world-renowned organization for building strong community-based health systems. This is the organization behind what's become known as the Massachusetts model for what's scaling up as a contact tracing operation and what the best looks like. As one of the group's earliest out-of-state collaborations, Illinois has teamed up with Partners in Health to learn from their global experience to determine what's worked, what doesn't, and what challenges they face as they design a community-based program in Massachusetts. Moving forward, Partners in Health will continue to advise IDPH on our program design and how best to tailor it to our communities. So what's next for Illinois? Most of our local health departments have provided their initial assessments regarding their ability to expand and deploy their contact tracing capabilities. And starting today and going forward, IDPH is gathering work plans and budgets from each department, allowing us to incorporate their local plans into our overall state plan and bring them online in the coming weeks. IDPH is immediately launching pilot initiatives with 2 local health departments, leveraging their existing operations and helping them expand their capacity. St. Clair County in the Metro East region and Lake County in the Northeast. Chosen for having significant needs in terms of case numbers in vulnerable populations, a capacity to grow their contact tracing, and great existing collaborations of public health personnel, medical students, and volunteers already on the ground. We're also in the process of incorporating other early leaders for this program, including the largest local health department, that's the one in Chicago, and we'll have more information on those additions in the coming days and weeks. In every region, the curriculum, software, and technology will be IDPH driven, and where needed, IDPH will support the funding of new hires at local health departments through federal CARES money and Disaster Relief Act dollars. As hires will be made locally, not through IDPH, compensation is determined by health departments in accordance with average rates in that region. That said, anyone who's interested in becoming a contact tracer can right now submit their information through IDPH, which will deliver names and resumes to the relevant local health departments. That interest form can be found on the IDPH website at dph.illinois.gov/COVID-19. Again, that's dph.illinois.gov/COVID-19.